Alright, we're going to talk about diseases and abnormal conditions of the reproductive system. First is epididymitis, which is itis, inflammation of the epididymis. Remember, that was that coiled 20-foot long tube. That's part of the male reproductive system. It could be caused from several pathogenic organs, streptococcus, staphylococcus, or gonococcus. It frequently occurs with a urinary tract infection or a prostate infection. It might occur with mumps, and it might also occur with sexually transmitted diseases. If epididymitis is not treated promptly, then it can cause scarring of the epididymis and sterility. The symptoms would be an intense pain in the testes, swelling, and fever. Treatment is antibiotics, cold applications, scrotal support, and pain medicine. The next one is orchitis, itis, inflammation of, again, and orchi, O-R-C-H-I, is a prefix or root word referring to the testes. So this is inflammation of the testes themselves. Could be caused from mumps, pathogens, injury, and it can lead to a wasting away or atrophy of the testes and cause sterility. Symptoms would be swelling of the scrotum, pain, and fever. Treatment might be antibiotics if that's indicated, antipyretics for the fever to bring it down, scrotal support, and pain medicine. Prevention methods include mumps vaccination, so the person doesn't get mumps, and then also it could be prevented by following measures to prevent sexually transmitted diseases. The next one is prostatic hypertrophy or prostatic hyperplasia, which is enlargement of the prostate gland. It's common in men over 50. The cause is a benign condition that's not cancerous, but the inflammation or tumor of the prostate or a change in the hormonal activity. There's also a malignant or cancerous condition that's also causes prostate cancer. So it could be either, and you need to have testing to tell which it is. Symptoms are difficulty in starting to urinate, frequent urination, nocturia, which is urinating at night, and dribbling. Symptom also might be urinary infection or urinary retention if the urethra is completely blocked off. Treatment would be, at the beginning, antibiotics for the infections, fluid restrictions, massaging the prostate, and then later on prostatectomy or surgical removal of all or part of the prostate. The last one is testicular cancer. Well, before we get to testicular cancer, that prostate cancer itself, they can do a test called the PSA test. It's a blood test, but it screens for prostatic specific antigen, which detects a substance released by the cancer cells. To find out if there is a mass or a tumor on the prostate, the doctor will do a digital rectal exam, and they should be able to feel the prostate from the rectum. To tell if it's cancer or not, they'll do a tissue biopsy. So if it's detected early, the prognosis is good, and they do suggest that men over 50 have annual prostate exams. The next one is testicular cancer. It's a highly malignant form of cancer that can metastasize, which is moved to other places as well. It can occur in men as early as age 20 to 35. The symptoms are a painless swelling of the testes, a heavy feeling in there, and accumulation of fluid. It's recommended that men begin monthly testicular self-examinations by the time they're 15 to tell if you've got any kind of a tumor in your testes. If you do have testicular cancer, the treatment is chemotherapy and or radiation and a surgical removal of the testes or orchiectomy. To do the monthly testicular self-examination, the male should examine the testicles after a warm shower when the scrotal skin is relaxed. Each testicle should be examined separately with both hands by placing the index and middle fingers under the testicle and the thumbs on top. The testicle should be rolled gently between the fingers to feel for lumps, nodules, or extreme tenderness. The male should examine the testes for any signs of swelling or changes in appearance. If you do notice anything abnormal, then see the doctor as soon as possible. Diseases of the female. First, we will talk about breast tumors. They can be malignant and they can also be benign, which means non-cancerous. Symptoms would be a lump or mass in the breast tissue, a change in breast size or shape, or a discharge from the nipple. Interestingly, males can also get tumors in the breast. Early detection of tumors is really important. You should do a self-examination of the breast. The American Cancer Society recommends that you do a self-exam every month. Choose a specific day of the month after you've had menopause or at the end of your menstrual cycle. You should examine your breasts in front of a mirror to look for changes in appearance, and you should also examine them in a warm shower after soaping the breasts up, and you can always examine them while lying flat in a supine position on your back. If you find any abnormalities, you should notify your doctor right away. In addition, women after the age of 35, between 35 and 40, should have a baseline mammogram, and between 40 and 49, mammogram every 1 to 2 years, and after age 50, every year. Those mammograms and ultrasounds can often detect tumors or masses up to 2 years before you can feel the tumor or mass. And when you're doing the self-examination, you're using your pointer and index finger, and you're moving in circular motions starting at the nipple and working your way around and out through the breast tissue to feel for any lumps that won't move or go away, anything unusual. Treatment would be a lumpectomy, removal of just the tumor, a mastectomy, removal of the breast, radical mastectomy, removal of the breast and muscle and lymph nodes nearby. And if it's malignant, then they might want to do chemotherapy or radiation as well. Next is cancer of the cervix and or uterus. It's called cervical cancer. It can be detected early by a pap smear. Symptoms might be an abnormal vaginal discharge or bleeding. Uterine cancer symptoms might be an enlarged uterus, watery discharge, or abnormal bleeding. And the treatments would be hysterectomy, surgical removal of the uterus and cervix, a pan-hysterectomy, which is a surgical removal of uterus, ovaries, and fallopian tubes, and chemotherapy or radiation. Endometriosis is an abnormal growth of endometrial tissue outside the uterus. Remember, the endometrial lining was the inside lining of the uterus? And that tissue can be carried by the fallopian tubes, by blood, by lymph, through surgery, and it might get embedded in a structure in the pelvic area, and it'll continually grow and shed. And it can cause sterility if the fallopian tubes get blocked with scar tissue. The symptoms might be pelvic pain, abnormal bleeding, painful menstruation, and depending on the age of the person and how much abnormal growth there is, the treatment varies. It can include hormone therapy, pain medication, and sometimes surgical removal of the organ. Ovarian cancer is one of the most common causes of cancer deaths in women. Frequently occurs between the ages of 40 and 65. Initially, the symptoms are vague, abdominal discomfort, GI disturbances like constipation or diarrhea, and as the disease progresses, there would be pain, abdominal distension, urinary frequency. Treatment would be surgical removal of all the reproductive organs and the affected lymph nodes, chemotherapy, and radiation. PID, or pelvic inflammatory disease, is an inflammation of the cervix or the endometrium, or the fallopian tubes, or at times the ovaries. And the causes can be bacteria, viruses, fungi. You might have abdominal pain, fever, a I can never say this word, purulent vaginal discharge, which means kind of pussy looking. And the treatments would be antibiotics, increased fluids, rest, and pain medicine. And then PMS is the least serious of these. It's premenstrual syndrome. It's a group of symptoms that appear 3 to 14 days before menstruation, and a lot of women may experience some degree of PMS. But it's usually from a hormonal or biochemical imbalance. Poor nutrition, stress can make it worse. Symptoms vary but might include nervousness, irritability, depression, headache or backache, edema, abdominal bloating, constipation, breast tenderness, enlargement. And the treatment is just to treat the symptoms. Modify your diet, exercise and stress reduction training, analgesics for the pain, medications to relieve the emotional symptoms, things like that. Next are sexually transmitted diseases, or STDs. These affect both males and females now, the sexually transmitted diseases or infections. The incidence of STDs has increased greatly in the recent years, especially among young people, and if not treated, they can cause serious chronic conditions, in some cases sterility or death. Acquired immunodeficiency syndrome, or AIDS, is caused by the HIV virus, the human immunodeficiency virus, and this virus attacks the body's immune system, causing the body to lose its ability to fight off infections and diseases, eventually causing death. It's spread through sexual secretions and blood. It can move from an infected mother to her infant during pregnancy or childbirth. It can also be spread through unprotected sex. Individuals infected with HIV could remain free of symptoms for years after this infection, and during the time they're free of symptoms, they can transmit the virus to others that he or she exchanges sexual secretions, blood, or body products with that. After that initial period without any symptoms, a lot of times they'll develop HIV symptomatic infections. Symptoms of that would be a positive blood test for antibodies to HIV, a lack of resistance to infection, loss of appetite, weight loss, fevers and night sweats, rashes, swollen lymph nodes, fatigue, diarrhea, all of which because the body's not fighting it off anymore. AIDS is diagnosed when that HIV virus causes a critical low level of the T cells, which are specialized white blood cells in the body, or when opportunistic diseases occur. Some of the opportunistic diseases that might develop are a rare type of pneumonia, a yeast infection called candidiasis, or the slow-growing cancer called Kaposi sarcoma. At present, there's not a cure for AIDS, but they're developing vaccines to try to prevent it, and they're doing research for drugs to cure it. They do have a drug cocktail or a combination of drugs to slow its progression. The best method for dealing with AIDS is to prevent it. Use standard precautions when you're handling blood or body fluids. Avoid high-risk sexual activities, such as multiple partners or homosexual activities. Use a condom or an effective spermicide as a protective barrier during intercourse. Avoid using drugs. Avoid sharing IV needles. Females that have HIV should avoid pregnancy. Everybody just needs to be concerned with eliminating the transmission of AIDS. Next is chlamydia. It's one of the most frequently occurring STDs. And I'm going to stop right there because I'm running out of time, but I'll start that again in a minute.